Hello friends. Now I'm starting a new topic today, that is urethra. In urethra, in this class I will deal about urethral injury. Okay, so urethral injury, that is injury to the urethra. So let me draw urethra first so that you get a good idea about. This is the prostate and prostatic urethra. The urethra in between the prostate is prostatic urethra, and then this is perineal membrane. So this urethra is membranous urethra, and now there is bulbar urethra. This is bulbar urethra, and then there is penile urethra, and there is a small dilatation at the end, which is fossa navicularis. So right, what are the urethra? Number 1, prostatic urethra, then membranous, bulbar urethra, this is bulbar urethra, and this is penile urethra, and this one is fossa navicularis. So this is the major anatomy of urethra. So now let us learn about the classification of urethral injury. There are majorly 3 different types of classification. So let us learn about them. They are really very simple. So number 1, based on the site of rupture. They are of 2 types. That is rupture of membranous urethra. That is rupture over here. That is first classification. And the second type is rupture of bulbar urethra. That is, there is rupture here. So basically there are 2 types of rupture. 1, rupture of membranous urethra, and then number 2, rupture of bulbar urethra. Right? The second one is depending on circumference of urethral wall. Based on the circumference of urethral wall involved, it can be complete rupture or incomplete rupture, right? What this means is the urethral wall is transected, or there can be incomplete rupture. In this, only a part of the urethral wall is transected. So it can be complete rupture or incomplete rupture, right? And the third classification is depending on thickness of urethra. It is of 2 types. Number 1, total urethra, and partial. Okay, so these are the different classification based on the these are the different classifications which are available for urethral injury, right? So first let us learn about the first type. If you see, as I have said, there are majorly 2 different types of rupture based on the site. Number 1, rupture of membranous urethra, and then rupture of bulbar urethra. So first let us learn about the rupture of membranous urethra, and then we can learn about the rupture of bulbar urethra, right? So, what really happens when there is rupture of membranous urethra? Okay, there is rupture of membranous urethra. So if we start draw again, so this is the prostate, this is the prostatic urethra, and then this is the membranous urethra, and then this is the bulbar urethra, and then finally this is the penile urethra. Bulbar and penile urethra. And then at the end there is a dilatation which is fossa navicularis. Okay, this is the major thing which is seen. So now there is rupture here. So this is the place where there is rupture. So it majorly occurs, the rupture occurs near the apex of prostate. So this is the apex of the prostate. So the rupture occurs near the apex of prostate. Okay. Now, what are the etiological features that you see in, what are the causes of membranous urethra? Causes. It can be caused by penetrating wounds, but most commonly it is caused due to a pelvic fracture. How does this pelvic fracture occurs? This is most common. Cause of urethral injury is by pelvic fracture. Now, that too in the pelvic fracture, whenever there is fracture of pubis, and ischial rami, this leads to urethral injury. So what is the impact in pelvic fracture? That is in pubic and ischial rami fracture. This majorly occurs in car accident where sudden force applied to one limb, or whenever a person lands on one limb while falling from height. Just imagine a person has committed suicide or fallen from a tree. So when he has fallen from a tree, then instead of landing both the legs, he only lands one leg. So during that, even in that situation, there is fracture of pubic bone or ischial rami. The other type of pelvic fracture may be butterfly fracture. Right? There may be other type of pelvic fracture which is called as butterfly fracture of pubic rami. Even in this, there is urethral injury. So in the overall case, there are pelvic fractures. Pelvic fracture is the major and the main cause for rupture of membranous urethra. These are the causes for for rupture of membranous urethra, or sometimes prostatic urethra also. So now, just imagine this is the pubic bone, right? So this, okay, I'll draw urethra with this is membranous urethra, and now again bulbar urethra, and then penile urethra. So this is the prostate, right? So prostate, and this pubis is connected by a ligament which is called as puboprostatic ligament. Okay, so when this ligament is disrupted, so due to pelvic fracture, there is disruption of puboprostatic ligament. So whenever there is disruption of puboprostatic ligament, whenever this ligament is disrupted, there is the prostate, and this prostate is called as floating prostate. Okay, and whenever there is this disruption of ligament, and also there should be rupture of the urethra and rupture of membranous urethra. So the prostate lost its connection. So the prostate lost its connection with puboprostatic ligament and also with this urethra. So this type of prostate is called as floating prostate, and this is called as a sign which is called as Vermeulen sign, which is seen in this membranous urethra rupture, right? Next, what occurs? So let us learn the classification of this membranous urethral rupture based on uretherogram. So this is called as maculum, cola, Pinto classification. In maculum cola Pinto classification, it is based on ascending uretherogram. Posterior urethral injury, it is classified into number 1, number 2, number 3. 3 types. 1, 2, 3. Okay. Posterior urethral injury. Posterior urethral injury is majorly 2 types. It is membranous and prostatic urethra. So both of them together called as posterior urethral injury. So here in type 1, if you see, there is elongation of prostatic urethra a lot, but it is intact. There is just elongation. Okay, rest all is normal. Okay, this is the prostate. There is just elongation of prostatic urethra. Then prostate is plugged off from the membranous urethra. That is, which is verumentous sign, which I have just described. So there is disruption of this membranous urethra. So here prostate is plugged off the membranous urethra. So there is extravasation of urine, right? All the urine will come into it. It can't enter the bulbar or penile urethra. So there is extravasation of urine above sphincter. So this leads to so-called floating prostate. That is Vermeuten's sign. So this is the second type of injury based on the classification, that is maculum colopinto classification. And the third one is there is total disruption of the urethra. So even the whole urethra is disrupted. Total disruption. See, if you see, all this urethra is disrupted. Okay, disruption of urethra with extravasation of urine. Above and below sphincter. This is type 3 posterior urethral injury. Now, let us learn about the clinical features which are associated with this type of urethral injury. What are the clinical features that are associated? So, clinical features. 1. There is, if you see, this is the membranous urethra and bulbar and penile urethra, and this is prostate, and this is the membrane. Okay, now whenever there is cut off either here or here, then the major thing that is seen is bleeding. So there is blood in the external meatus. Okay, that is first one sign. Next, because of this breakage, the urine which comes, that cannot pass here. So there is a blockade of urine, or better to say is there is failure or difficulty in passing urine. Okay, because of complete transection, you can see the urine leaks out. So there is extravasation of urine to scrotum or penis, perineum, or into the abdominal wall. Right? And there is blood in external meatus. Loss of blood leads to, there is hemorrhage basically. So this leads to shock. Right? There is pallor. And this also causes increased pulse, which is tachycardia, and there is hypotension. If you see per rectal examination, on per rectal examination you can see floating prostate. So these are the major clinical features which were seen on posterior urethral injury, that is injury to membranous or prostatic urethra, most commonly being membranous urethra. As this is due to a road traffic accident, all the other types of injuries should also be looked for. Look for any other injuries. Right? How do you diagnose it? So what are the investigations done? Investigations done are X-ray, pelvis, next ultrasound, abdomen, and finally urethrogram. This urethrogram is done to see the type, to see the site and type of tear. So these are the investigations which are done. Now, treatment. How do you treat this condition? Now the urethra is gone, it is transected. So what are the treatment options available for this problem? So treatment, first let us learn about the treatment of complete urethral rupture, and later you can learn about incomplete urethral rupture. If complete urethral rupture, then you have floating prostate, right? So, as this rupture is complete, you can't open it below, right? You can't pass a catheter. Okay, let me draw a diagram. So what do you do in floating prostate whenever the rupture is complete? Here there is rupture, right? So now you can't go from below, right? Because there is rupture here and there is extravasation of urine, and if you see even all the thing, you can't go through here. So you should open the bladder. So what you should do is, I'll draw it again here, I'm sorry. This is the bladder. This is the urethra. Number 1, prostatic urethra. And then membranous urethra. And then bulbar urethra. So here, whenever there is the transection, transection here, then we can't approach. In order to repair this, we can't approach it like this. So we'll have to approach it through bladder. So bladder is opened. And then so what do you do? First, bladder is opened. So after opening the bladder, so through the bladder you will pass a metal tube. Okay, this is the metal tube. You will pass a metal bowkey through the bladder. Okay, and one more metal bowkey is passed from below. Okay, so you are passing 2 metal bowkeys, one from the above and the other from the below. Okay, so that both are manipulated in such a way that both meet with each other. So, and then lower one is negotiated into the bladder itself. Okay, and then so at its tip you will tie. Now here you will tie a rubber catheter. A catheter is tied, and after tying a rubber catheter you will withdraw it, so that the rubber catheter is passed from the urethra above to the below. So this rubber catheter, after passing it, this rubber catheter will come down, and this rubber catheter, through this rubber catheter you will pass a Foley's catheter, and it is tied and pulled up and kept in position. Okay, first you have passed a rubber catheter. To this rubber catheter you tie a Foley's catheter, and that is kept in position. Now this bladder, this opening is closed as SPC, right? So this is what happens here. So let me draw good pictures for it so that you will understand. So this is the bladder. This is the prostatic urethra. And then you will have membranous and this one. This is the second one. I'll just draw two diagrams so that it becomes easier for you to understand. Just give me 1 minute, okay? I'll complete drawing all these. So now here first you will cut the bladder and you will pass a metal bowgie through the bladder. Okay. So first pass metal bowgie through bladder. Okay, and then one more metal bowgie from below. Passed through ureter. To bladder. Okay. So this is already there. One metal bowgie. And to this, along with this, you will insert one more from the below up to the bladder. Okay. So here there is a transected part. This is the transected segment. This is the transected segment. Okay. It is inserted above. Slowly. And now, to this tip, you will tie rubber catheter from the bladder, because bladder is opened, right? So through this opened bladder, you will tie a rubber catheter to the lower metal bowgie. So here this is the lower one, and then you have tied a rubber catheter. Okay, and this is the upper one. And now pull this lower metal bowgie okay, I'm sorry, this is the way. You have passed it and you have put a rubber catheter attached to its tip. So now you will pull the lower metal bowgie to outside here, like this. So that this keeps the catheter in place. Okay, so this is the technique which we use for floating prostate. So in our next class, we will learn about the other technique for incomplete rupture, and then the rupture of bulbous part of urethra. Thank you guys for watching my lecture, and if you have any doubts, you can comment in the comment section. Thank you.